So you started on testosterone cypionate injections, and now you want to know what to expect and when to expect it as far as symptom resolution. This is what we're going to talk about in this video. We're going to talk about what to expect, when to expect it, and when not to get discouraged. Let's start off with the typical progression of symptom resolution. It takes about 3 months to start moving into symptom resolution, to start feeling better from all the symptoms that you had when you first got on testosterone replacement therapy. This means that when you do your 3-month follow-up with your provider, you're not going to say, oh, I'm fully optimized, I feel amazing, everything is great, everything is fixed. More than likely, you're going to say something like, yeah, I recently started to feel better, and then you'll give the list of the ways that you're now feeling better. Now, typically the progression of symptom resolution starts with psychological improvements first. Psychological improvements look like increased motivation, feeling like you have a little bit more energy, more confidence, just feeling a sense of overall well-being. Libido, or the desire for intimacy, is also a psychological factor that you might start to see improve first. Now, these psychological improvements typically happen toward the 3-month mark. Following the psychological improvements is when you can expect to see physiological improvements. Things like seeing your efforts at the gym pay off. You might notice that it's easier to put on muscle while losing fat. You might notice that you have more endurance, you're feeling stronger, and you might notice stronger, better erections. The physical improvements typically start to take place after the 3-month mark. With that being said, and this typical progression and timeline of symptom resolution, it's very common for guys to report several weeks into their testosterone replacement therapy that they're feeling better. And a lot of guys report a physical improvement that comes several weeks in from starting their testosterone replacement therapy, and that is better erections and experiencing more consistent, spontaneous morning erections. In other words, morning wood. So yes, there is a progression and timeline of symptom resolution. However, your individual experience is going to be your individual experience and not to be compared with someone else's that you might have seen in the comments, or your friends, or someone you might have read off Reddit. Now, if you're 3 months into testosterone replacement therapy and you're not noticing any changes, don't be discouraged. This is because testosterone replacement therapy is not an overnight thing. It's not a few injections in. It takes time for your body to optimize to its new testosterone levels. When you see your provider in 3 months, you might need to do a dose adjustment. You might need to do a protocol adjustment. So don't compare yourself out of success on testosterone replacement therapy by comparing yourself to the next guy. Your symptom resolution might begin earlier than the 3-month mark. It might begin a little bit after, and that is okay. One thing I tell my patients is to do the injection and then make the lifestyle changes. Do the injection, forget about it, and start making those lifestyle changes. Optimizing your testosterone levels will have a positive impact on your low T symptoms, but at the same time, you also need to take personal responsibility and make those lifestyle changes. If you eat like crap, start cleaning up your diet. If you don't sleep good, start having better sleep hygiene. If you're not moving, you're not exercising, start implementing those things into your life, and you will see changes. Again, don't be discouraged. If you don't have full symptom resolution 6 weeks in, give it time. Stay consistent, make the changes on your part, be patient, and you will see your efforts paying off while you are being supported by testosterone replacement therapy.